Thank you for your interest in becoming a preceptor for our students during the capstone phase. Overseeing our program is Medical Director Dr. Burney. Tony Milan is co-owner of Respond Right EMS Academy and Program Director and Clinical Coordinator for the Paramedic Program. Donna Weiss is co-owner of Respond Right EMS Academy and CEO of the program. Any questions or issues with students can be directed to Tony or Donna. We are happy to answer any questions you might have. Myself, Tony Milan, and Donna would like to take a moment to personally thank you for being a preceptor. As paramedics ourselves, we understand the daily struggles you may encounter and appreciate the fact that you are willing to help educate our future paramedics. If you ever have questions about our clinical requirements or have concerns about students, please feel free to contact us. What do you need to do today to complete this training? It's simple. Review this information and complete a few questions at the end. What are the objectives of this training? We will talk about the purpose of Capstone, define what a team lead is, discuss the required number of team leads, explain the required paperwork, and explain the evaluation and scoring during Capstone. What is the purpose of Capstone? Capstone is the final phase of our program. To be eligible to enter Capstone, students must have already completed the following: all didactic and lab requirements in Phase 1, all clinical and field requirements in Phase 2, and have kept current their CPR, ACLS, PALS, and PHTLS. During Capstone, students must be able to demonstrate they have the knowledge, skills, and attitude to manage any call. It will be the student's responsibility to demonstrate they are able to manage the scene, direct other rescuers on the scene, direct patient care, develop a patient care plan, and complete the required paperwork. The student will be able to complete a comprehensive assessment, formulate and implement a treatment plan for the patient, perform most of the decisions, formulate a field impression, direct the treatment, determine patient acuity and disposition, and package and move the patient. Our goal is to prepare competent entry-level paramedics in the cognitive, psychomotor, and affective learning domains, with or without exit points at the AEMT, EMT, or EMR level. What is the definition of a team lead? Team leads occur during Capstone, in which the student applies the concept acquired and demonstrates that they have achieved their terminal goals for learning. Students must be able to demonstrate entry-level competency as a paramedic in the cognitive, psychomotor, and affective learning domains. Students must be performing as a job-ready, entry-level, competent paramedic. You will see students practicing team leads before they enter Capstone, so they can gain a strong understanding of what is expected. During Capstone, students must complete a total of 20 ALS team lead calls. An ALS call is any call where a medication other than oxygen is administered, or an EKG and IV are performed together by anyone on the team. Team lead calls must be transported to the ER, so the student has the opportunity to provide the radio report, handoff report to the ER staff. The student must successfully lead the team and conduct a comprehensive physical assessment with minimal to no prompting by the preceptor. Students must complete each call with safety in mind. No action can be initiated or performed that endangered the physical or psychological safety of the patient, bystander, or other responders and crew. The student must achieve a score of 2, which is successful, in team leadership, and the preceptor must agree that the student has performed as a job-ready, entry-level, competent paramedic during each rotation. Students must also achieve competency on a clinical, affective, behavior evaluation from their preceptor during their capstone rotation. We currently use a program called Platinum Planner that allows students and preceptors to digitally document and improve documentation. Students are able to document patients on a phone app or through the desktop version. Pictured here is the mobile app version. Preceptors can click on each tab across the top to review shift documentation. They should start by verifying the location, time, and duration of the shift. Next, preceptors should click on the Patients tab. They should review all the patients and skills that have been documented, along with if the skills have been documented as successful. Preceptors should understand that students The desktop version is almost identical to the mobile app version. The only difference is the tabs run vertically along the side. The preceptors will still review all the information and sign on the Submit tab. Physical paperwork is only used when there is an issue with Platinum Planner. All the same concepts still apply. Preceptors will be required to verify the date, At the end of the day, the preceptor will be required to evaluate the student's ability and whether or not they believe the student performed as a job-ready entry-level paramedic. To be a successful capstone day, the student must demonstrate they were successful in team leadership and must perform as a job-ready entry-level paramedic. The preceptor will be asked to rate the student as either successful, marginal, or unsuccessful. Preceptors will be asked to evaluate the student's patient interview skills, impression and treatment plan, communication, physical exam, skill performance, documentation, and team leadership. Here are some common questions we get asked. Does a student have to be with the same preceptor during capstone? No, not at all. This is the student's discretion. We encourage the student to complete capstone at a site that they are comfortable with and preceptors they are comfortable with. Students are able to schedule capstone however they want to. Do I need to evaluate the student every time they ride with me? Yes. Feedback is important for us and the student, so completing an evaluation every day is important. How does a student schedule capstone shifts or rides? Every capstone site has a little different procedure. Some sites prefer the student to contact the director or coordinator at the site. Other sites prefer that I coordinate the schedule of the student with the site. So capstone is only ALS calls, right? Yes. During capstone, team lead calls are ALS calls that are transported. Team leads during capstone must be ALS calls that meet the requirement of either medication other than oxygen or IV and EKG. Those skills can be performed by anyone on the team, the student or a team member. What type of assessments do students need to get during capstone? Any assessment category will qualify as long as they meet the ALS team lead requirement. Students can acquire assessments in chest pain, abdominal pain, trauma, anything at all as long as it is an ALS team lead that is transported. If we are slow, can I send a student home early? No. Students can learn a lot from a shift even though they're not running a call. So please keep the student there and let us know if you have trouble with students who want to leave early. What if a student fails capstone? Students can be remediated. We have a process for remediation. Please let us know what their weakness is. We will ask you where you think that student should be remediated. Remediation includes lab time, time back on an ambulance in the field, and it could include time back in a hospital, depending on what your input is. As long as the student has not egregiously put the crew or patient in harm's way, they will be allowed to go back through a remediation process. We understand you are preparing our future paramedics, and we appreciate your dedication and time. Thanks again for all you do. Have a great day.